Now, a message that we've heard throughout the day: housing is more than a roof over our heads. It's the foundation for safety, dignity and opportunity. Yet for too many women, that foundation is fragile or out of reach. Laura, you've already said the system isn't set up for women and children, and we need to create our own system. Kate, why should we apply a gendered lens to the issue of housing?
Yeah, thank you. I'm doing a piece of work at the moment, a fabulously enjoyable and interesting piece of work with Australians investing in women, talking about this topic of applying a gender lens to housing, which is essentially the idea that people experience outcomes of programs and issues in different ways depending on their attributes, and one of those ways we can slice it is through gender. And I justify it in different ways depending on who I'm talking to, but generally I would say it improves the impact or the targeting of your program. Sometimes I say it's better market segmentation if I think that's going to get me over the edge with the person I'm talking to, or it improves the rigor of the analysis that you're doing. And in some instances that's really obvious. You know, we've often heard the argument that women are more likely to die in car crashes, or are fundamentally significantly more likely to sustain significant injuries, and that's because over time we tested seatbelts on male bodies, not female bodies. It's just not designed with that end user in mind, and the same is true of housing, that if we're not designing with that impact, then we're going to design an outcome that isn't targeted. And we know from looking at housing systems that outcomes are different for women. So it's fundamental to how we think about it.
So what does that mean in terms of building seatbelts the right way in housing?
Well, we know that 55% of people in social housing are women, and 60% of people turning up to specialist homelessness services are women and girls. So part of that is coming from a systems design which is trauma-informed, as everyone has spoken about today. It's about thinking about safety and privacy around the considerations of pregnancy and breastfeeding. It's about thinking about the experience of girls as they age into women and what they need when they're learning. So yeah, it kind of infiltrates through everything.
Laura, you spoke earlier about this past few years we've been seeing everything in crisis mode, probably as it should be, but you say that the scale and complexity of family homelessness demands more than a crisis response. Do you want to go more into that?
Yeah, I will. And kind of following on from what Kate was saying, actually, in terms of what a gendered response to housing looks like on the ground. So one of the things that we are most proud of is we're now 3 years in operation, a project called Viv's Place, which is in a low socioeconomic part of Melbourne, and it's 60 apartments specifically for women and children. And it's, the first of its kind at that scale, which has had lots of things that we've learnt through this process. But one of the things that we did was we engaged with women and children as we were designing the building. And so it looks different to standard social housing. It has everything that each apartment that's over 2 bedrooms has a bath in it. And I was reflecting on that earlier in one of the panels, and we were talking about the value of that. It's a huge thing. Like, I'm a parent myself, and I know that sometimes you need the space that is given by calming people down, your own children, in a bathtub. They all have washing machines. We're not expecting people to use communal washing machines. And we know that the volume of washing that you're dealing with can be in that case. We wouldn't build studio apartments for women with children again, or women with babies, because sometimes, the advice that you're given by a maternal and child health nurse is if things are getting too difficult, just close the door, put the baby in the cot, and you go and make yourself a cup of tea. You can't do that in a motel room or a studio apartment or anywhere else that is just you and the baby that you're living with in that space. So all of those things are kind of, when we're talking about what a gendered approach to housing is, that's what it looks like on the ground. It's thinking about it. It's having pram parking. It's having lots of space for little bikes and scooters that are safe and secure. It's having outdoor space for kids to play in. What we do differently next time is we'd also build a basketball ring, because we didn't realise how much family reunification we'd get and how many teenagers would then be able to move back home with their parents. And we have flexible communal spaces but not flexible outdoor spaces. So we would do that differently next time. But it's thinking about how we translate that research into practice on the ground.
I want to talk more about Viv's Place with you, but what you've just spoken about with those studio apartments, Kate is a housing researcher. When you come to a forum like today and you hear all of these people talking about the need for women and children, families and children, how does that change what you see in the data of your research?
Yeah, this has been a great conversation to be watching and to be part of because, as you say, I usually live in housing land, not homelessness land, and of course they are very closely aligned lands. But I find that the discourse is slightly different, and this is a far more human discourse, and there's more discussion about services. But I find when I go to panels and conferences specifically about housing, sometimes we talk about bang for buck, and we talk about taking people off the housing register. And when we talk about that, we talk about single people. And we talk about the fact that we need to be building lots and lots and lots of one-bedroom apartments and studio apartments because that gets homes on the ground. And it's so vital to be coming back to this question and the statement that was made earlier about the fact that the strongest indicator for being homeless in adulthood is being homeless in childhood. And so I'm really coming around to, yes, we can look at the data that says we need to be building one-bedroom apartments, but families are really, really important. And in all of these ways that you've spoken about, Laura, one bedroom might be appropriate at one point in time, but it doesn't provide a lot of flexibility. And a lot of people are doing kinship care. Even if they don't have children, there might be grandparents providing care. So those kind of things of building at scale, while also thinking about the humanity of these systems is in conflict and is really important to be teasing apart.
We kind of see that in the political sphere as well, don't we? We hear the data about what housing is being delivered at X number of single dwellings, and we don't think about the actual type. But
it's interesting. It's something we've been advocating about is the use of language. So we talk about the number of dwellings rather than the number of bedrooms. Or we talk about the number of dwellings rather than the number of people housed. So I could say we've got a 60 apartment building in Dandenong, or I could say we're housing 200 people in Dandenong because that is how many children we have, between 108 and 130 at any point in time, depending on who's living there. And it's also when you look at the data about who's on the housing registrar. So the 1 and 2 bedroom conversation comes from the fact that proportionally there is a much higher number of people. The length of time that people are on those waiting lists is significantly different. Families are often on for 4 or 5 years. Singles can be 18 months. And so it's when you look at data and talk about it in the language we use that can shift how the policy conversation works.
Just to pick up on that, human beings housed versus dwellings built. I don't know if it's the same in Queensland, but one of the key things happening in Victoria at the moment is public housing renewal. And we're seeing a lot of older developments being knocked down and rebuilt. But they're being knocked down and they were three-bedroom apartments. They were 2, 3, 4-bedroom apartments. They're being knocked down and replaced with 1-bedroom apartments. And so there's a small uplift. There's a 10% uplift in the amount of units that we're providing, but there's actually a reduction in the amount of people who are being housed. And I think where we really hit the ground on what's happening, language matters. It really, really matters. So, yeah, I agree. We should talk like that.
We should get you two together somewhere. Laura, the launch housing, you spoke about the project of Viv's Place. Can you take us back to the beginning? How was that funded, designed and delivered?
So it was a really interesting project, and we knew what we wanted to do, but where became a question and who we were working with. But the importance of philanthropy in this was essential. So all of our seed funding came from philanthropy, and actually the money for the land came through the Australian Nursing and Midwifery Foundation because they were looking at it and went, do you know what? So many of the women that need this service are our own members. And whether it's now or in future or the people that they're working with, this is really important to us. And so it was a little bit of a departure from where they normally invest, but they did it because they thought it was core to their values. And so that allowed us to start getting it off the ground because anyone who's in who's also a community housing provider, knows that sometimes it's the access to land that can be the most difficult thing when you're trying to build something a little bit different that doesn't fit a standard government prototype, I guess you could say. So we ended up with, I think in the end, about 60% philanthropic funding for the build, and then the rest came through from government right at the end, which was great because we were able to build it. Then we've been able to get, a lot of you are in this sector, 2-year rolling funding for the concierge service, which is our resident engagement officers who provide not just, they sort of provide support, but a big part of their role is managing visitors. At any point in time, a third of our residents have IVOs, active IVOs. Sometimes there's more. So managing that visitor entry and how people work in that space has been an ongoing process. They also run our resident engagement, which we've changed our house expectations quite a few times based on renter feedback, because it is the first time we've done this. And so some of the things we did early on are different now. And how that funding has worked ongoing to do the nice to have the case management support is a lot of partnerships. We have partnerships across a whole range of sectors, a lot of in-reach support, some philanthropic support for our education programs where we can get kids engaged again in school. And the thing that we've found is we had a really solid outcomes framework. And our expectations of the outcomes for children in particular were that we were thinking that was a medium-term outcome for stability and back into the system. But actually, within 3 months, we had most of our children settled and back in school, sleeping through the night, because that's someone mentioned that earlier, that's one of the things we also check in on. And it's, yeah, but the funding is a very complicated relationship matrix.
Don't we know it? Kate, you've done a road trip around Australia and looked at what works and what doesn't. You've held a round table in Brisbane with various stakeholders. Some of them are here. What's the state of play in Queensland as you've witnessed?
Firstly, it's really fun to be road tripping around Australia. It's great. I reflect that there's not that much variation. That the stories you hear in Queensland are very similar to the stories you hear in New South Wales, you hear in South Australia, you hear in Victoria. Those themes of an underfunded system come through, themes of increasing private rental costs and house prices and how all of these different things butt up against each other are kind of universal. I would say a few things that are exciting to me about Queensland or that stand out as being a bit different is since we're talking about young people, one of the key things I heard in the roadshow in Queensland was around the youth subsidy and the impact that that's had for community housing providers, and this acknowledgement that youth allowance is simply just so low that you can't house a young person without a supplement. And I speak to people in South Australia about that, and they're like, we're having exactly the same problem. That would be a huge benefit to our state. So I think Queensland doing that is a really great step. I think the amount of youth foyers that we're hopefully going to see in Queensland is just so exciting. 8 committed youth foyers in Queensland is a huge change. And I say this with a caveat that I haven't lived in Queensland in a really long time, and I know there's scepticism, but given that there is a commitment to 53,000 social homes by 2044, if that happens, that's monumental. That's huge. That's our current stock in Queensland and 75% more. Like that's building more, almost as much in Queensland every year as all of Australia has built each year in the last decade. So I'm skeptical because that seems like a big thing to achieve, but if that was achieved, that's game changer. That's massive. So that would be great. Please do that.
So you talk about you haven't seen a lot of variation from state to state. We are a bit of a unique demographic here in Queensland because of our southeast versus the rest, basically. So what is it with regional and rural versus the cities?
Yeah, I think it's useful to look state to state. But I guess to pick up on some of the themes that's happened today and this question of really place-based initiatives and really localised disadvantage or localised contexts, I I actually wanted to reflect on my own experience. I'm from far north Queensland originally. I'm from Alarish, which is 350 people in a sugarcane farm area near Tully. I'm going to name places until I get nods.
Everyone knows Tully.
And my experience growing up is very indicative of a rural experience in that my mum was the GP, the only doctor in town. My dad, this is not a typical experience of the 90s, my dad was a stay-at-home parent. And my mum's experience of coercive control was very much coloured by a rural experience, in that being the only doctor in a town, she knew every single person. And her fear was, if I tell one person, the whole town will know. Give it 45 seconds. Like, there's no crisis accommodation in rural Queensland. Well, there is, but there's no crisis accommodation in Alarish. There's no public transport. We're a one-car household. If she went into the local legal clinic, everyone in the community would have seen her immediately. So I guess it's not so much that, it's that every solution and every experience is different. And a lot of that is based on geographical and cultural and social specificity. So we can think at the broad system scale, but then it comes down to a very human scale as well.
Laura, how do we get the money? How do we pitch these ideas and show what works to the people who control the purse strings?
Well, look, honestly, if I had that answer fully to that question, there would be Bibs places and Cornelia's everywhere, which is the Pregnant Women's Program. But it's kind of following on from what Kate said. It's also about the place, because what we find is that when you are looking for funding for programs that are innovative or different or haven't been done before, they need to be linked to place. They need to be linked. I'm not 100%. I can just talk really loudly. They need to be linked to the idea of what that particular community needs. And there are a lot of funders within communities. There are a lot of people who, for example, we work in Ballarat, where the Ballarat Community Foundation is a huge part of helping build a solution that works for that individual community. Then the other end of the scale is the national advocacy. And the statewide advocacy, because the more voices that you can bring together, the more chance you are of having changed things. And there's been a lot of talk on and off today around the foyers, and I've been a big part of the Foyer Foundation, and the work that they do in order to get national attention on an issue that has often gone unrecognised has been essential. And that has been because so many different people and organisations and service sectors have come together saying exactly the same thing. And it's part of why we launched the Insights paper, so that we can get that conversation. So you have every service sector that's working together acknowledging that this is a thing we need to do, and that investment needs to be targeted and tied, and you need to have a lot of patience and a huge amount of resilience, because there's a lot of knockbacks on the way through. But you can get there. It just takes a bit of time.
So, it's just because I've confused them because we've picked up different mics now. But sorry, just throwing a curly to the audio desk there. So, what are the barriers to applying gender analysis and improving gender equity in housing?
Yeah.
Are there any?
There are plenty. The good news in talking to people across Australia about whether they're applying a gender lens is that most people will say that their organisations or departments are applying a gender lens to various degrees. If you ask them if they're applying an intersectional gender lens, almost everyone will say they are not. So there's some gaps there. But some of the barriers are that often... intersectional gender lens, you mean that different departments are coming at it from a different approach? No, I more mean we're thinking through gender, but can we also think through gender and indigeneity, right, or gender and disability, or gender and cultural age? Yeah. Okay. And that's tricky, right? And the more cuts you add to it, the more challenging it becomes to do that kind of analysis and that design. Yeah. A lot of the time, a gender lens can become a nice to have. And particularly when we talk about social housing and homelessness, it starts to become, there's a real strong scarcity mindset, because we're all like trying to do the best we can in an underfunded system. And then it becomes a discussion of, I just want to get things done. And so if we look at like the Housing Australia Future Fund, which is one of the biggest sources of funding coming into our system at the moment, they're supplying housing, they're supporting housing, but there isn't a gender lens. There's no kind of like intersectional ageism perspective or anything like that. So yeah, it kind of becomes a cherry on the top sometimes. On a more day-to-day basis, sometimes there's a lack of skills. People just don't know how to do that analysis. And a lot of the time what we're hearing is we just haven't put forward the business case particularly well yet to describe why we should be thinking and doing things from a gender lens. So there's some of the things that come into play.
We have a couple more minutes. Laura, how do you want to wrap it up today? Speaking to this room, what have you heard? What would you like us all to know?
Well, that's like a really big question.
We'll give you 30 more minutes.
I know. Look, this is an area that I'm particularly passionate about, and I think being in this room and hearing from everyone who has spoken, all the ingredients are here. Like, if you look across all the states and across the country, we have so many good things that are happening and so many pilot programs, some of which are similar. And I think there's probably more we could do to start supporting each other into bringing those together. I was listening to the education programs before, thinking about the ones that we run, and we're like, oh, we could do something like that. And, oh, our Families Hub could be like that. And I think bringing those communities of practice together across the country is helpful because the more scale we get, the more likely we are to be able to implement across the entire country and share what we know. But it does give me hope that there is a conversation this year, and I don't know, people this Homelessness Week are talking about families with children, and I think that is the very beginning and the starting point of where prevention happens and where we can make change. And it's a difficult thing because you talk about needing to apply a gendered lens, and there's a really strong part of me that's like, we should have started there first. What we're trying to do is change a system that actually has a gendered lens, it's just a male one. And we need to be thinking about it as, we are talking about a whole range of other people who need housing and supports that support them, and we know what they are, but they shouldn't be pilots, they should be the mainstream.
Yeah, sure. I guess one thing I've been reflecting on is the pilot or the fine grain versus the system and the systemic response. And maybe to pick up on the all ladders, no snakes. I was about to say all snakes, no ladders, and that would have been
snakes, no
horrifying. I think it's really hard to have a system that doesn't have snakes and only has ladders if you're jumping from one great opportunity to another but falling through cracks in the interim. And so I think it's great to have things like Viv's Place. It's great to have these wonderful things popping up. But I think to talk to, I think it was Tamika who was saying this experience of kind of bumping from things and then going back to where you started is it's the rule, not the exception. So if we had something that was at scale, then that experience wouldn't be the standard experience. So thinking at the human scale and the system scale is important.
Thank you both. Please join me in thanking Laura Mahoney and Dr. Kate Raynor.